infections in the air around this period?
Oh, actually, all year.
All year round,
yes,
especially in cold weather,
Yes.
you would experience,
Yes.
because today we're taking a look at respiratory infections. So tell us, when we say respiratory infections, what are we talking about?
So it's when we have the unwanted microorganisms within the respiratory tissue. So that's from your nostrils, from the nose to the sinuses. Those are the bone spaces within the skull, the face, down the back of the throat, where you swallow through, down to the trachea, then the branches into the lungs and all that. So any infection within that whole space. And sometimes they also consider the inner ear infections as part, because they are also connected through the sinuses as well.
Okay. Now, I want to get this because I never get it. Sometimes you get sick, you go to the hospital, you do labs or whatever, and they will tell you it's an infection. Right. So when you say infection, what are we talking about?
Infection is usually microorganisms like viruses and bacteria that have infiltrated the tissue. And they are causing their own havoc in there.
So when they say infection, it feels like something big, it's big anyways.
It depends on how far the infection has gone.
But do we have different types of respiratory infections, and what are they?
We define them based on where the infection is. So we have the upper respiratory tract, that's the head up down to the throat level, and then the lower respiratory tract, that's from the neck down to the lungs. So the common one we have is the common cold, usually a viral infection. That one, it usually affects maybe the nostrils, and then sometimes the sinuses, sometimes the sore throats. Then sometimes we have a laryngitis, pharynx, so that's inside the throat area there, and then the roof of the mouth in there. And then the tonsils, tonsillitis, they are just on the side. I don't know how to explain this for radio people to get it, but so
I think we know our tonsils.
Tonsillitis, yes. So we have rhinitis, and then rhinosinusitis. So that's combination of the nasal airways with the sinuses as well. So these are the different types. That's the upper, and then the upper one. The lower is the bronchitis, and then the pneumonias, sometimes tracheitis, but that's not very common anyway.
It looks like the upper respiratory tract infections, it feels superficial to me. The lower ones is more serious.
Actually, yes, they tend to be more serious conditions than the upper.
What are the causes?
So it's usually the microorganisms that are spread around. So it could be from direct touching, maybe you are cleaning your baby's nose and all those things, your fingers are touching the actual discharges from the person, or it could be the indirect. We have the aerosols, and then the fomites. So there are droplets as well. So when someone sneezes or coughs into the air without covering their mouth, it's like the person has sprayed, like how you spray
the aerosols.
So those tiny droplets like particles, that's what comes out of the person's mouth. So when those aerosols or particles settle, maybe they settle on the table or on a doorknob or something,
on some cup or some plate or something.
Usually doorknobs that people are always opening. Maybe someone sneezes with a hand and he touches the doorknob, and then it stays. Sometimes it can stay for hours on the doorknob, and then you just come and you also
touch it.
Yes, you open the door, and then
you send your hand to close to your nose.
Your eye will be itching, and then you scratch
it,
and then you've also gotten the organisms on your body. Then they travel wherever they can get.
Let me just veer off a little bit. Which one is more serious, viral infections or bacterial infections?
It depends on the virus, but generally most viral infections are not that severe. The body can put up the immune system can put up a response to fight the viral infections mostly. It's just sometimes something like COVID-19. Yes, that was a viral infection, but the body could not fight it, and then people went into respiratory failure and those kind of things.
I think you've mentioned some, but let's just go through the common symptoms which are associated with the respiratory infections.
So the commonest one we have is the coughing and the sneezing. The upper respiratory infections, we usually get the stuffy nose or the runny nose, and then we get sore throat sometimes. Then the generalized symptoms are the headache, muscle pains, body weakness. Sometimes they get bad breath, especially if it's the tonsils.
Okay.
And if it's sinusitis, they feel facial pain. So under the eyes, where the sinuses are, when you press those places, you feel pain over there. And then there's fever as well, and then sometimes tightness in the chest, difficulty in breathing. Those are the common ones. But when they become more severe, then you have to go to the hospital. So those ones are not so common. Very high temperature, unable to swallow. So the pain is so severe, or the swelling is so severe in the throat, they can't swallow solid food. Difficulty in breathing. And in those cases, you see, especially in the children, you see the nostrils are opening wider with every breath. You see that the chest muscles are going down very much. Even if you look bare-chested, you see in between the ribs is going inside. Sometimes you even see that they are even using their stomach muscles as well to try and then assist their breathing. So those ones are the severe symptoms. Also, maybe the person may cough so much and so severely that the person will vomit, or the person coughs so much that they can't even like sleep or do anything. Yeah, so those are the severe symptoms. And maybe dizziness, and then especially with the asthmatics, you can have the wheezing.
I was going to ask you about that. I was going to ask you if asthma is a respiratory infection.
Asthma is not an infection.
Because the reason why I ask is my young boy is 7 now. He gets these respiratory infections, and the symptoms I'm talking about, you see the movement of the chest, the stomach is trying to, forcing the breath and all that. And whenever we go to the hospital, they ask you, is he asthmatic? Is he asthmatic? I keep telling the doctors, you have to diagnose it. Why are you asking me if he's asthmatic?
No, if you have an official diagnosis from a doctor, they will tell you that your child is asthmatic. So that's what, when we ask, is he asthmatic? That's what we are asking, not if you have diagnosis.
Every time I go there, they ask him, like, I've not been given any diagnosis, whether he's but he's been having these infections a lot. He's been on admission a couple of times.
So some children tend to have those, and it's more of like a hypersensitivity reaction than like an infection per se. But infections can trigger those kind of reactions. But in children, we call it bronchiolitis. It happens for a few times, but then once they grow out of that stage, it stops. But some kids, they have it. If you have it more than like 3 times, then we'll rather be veering towards a diagnosis of asthma. Okay.
So we're talking about respiratory infections this afternoon on the drive with the area gang. Hello, Doc, and we have Dr. Emefa Dzide with us. We've looked at the causes. We've looked at some of the symptoms. Now, when do we need to seek medical attention? Because especially when we mention common cold, we know that it will pass and all that. But when do we have to, go to the hospital to seek medical attention?
Okay. So it's if the symptoms have lasted more than a week. Okay. Normally, the viral infections, they might be very severe for about a week, but after a week, the symptoms tend to go down. Yeah. So you can just do those supportive things you do, drink a lot of fluids, maybe some paracetamol, just rest and those things, and it goes by itself. But if it stays longer than that, or if you have maybe a very severe cough that's not allowing you to sleep, or if you're having the respiratory distress, what I described, the difficulty in breathing, that you see the muscles all trying to contract, then the nostrils are flaring wide and all those things, or there's wheezing, or there's stridor. It's any noisy breathing. If you hear, breathing is not supposed to be noisy, so the moment you start hearing noises when the person is trying to breathe in and out, then you should report to a hospital. Or if the temperature is very high, above 37.5, or they can't eat, are vomiting and those kind of things, you have to take them to the hospital.
Let me veer off again, because you said breathing is not supposed to be noisy. Snoring, is it breathing? Is it when people snore? Is it a medical condition when people snore? But that's breathing, right?
Well, it's breathing, but there's some difficulty and there's some obstruction in there. Yes. So some people Sometimes it's just maybe your positioning in bed, but some people, there is actually some swelling in there or some overgrowth in there that is causing the person to snore.
Okay.
Some people, when they have infections, they snore, but when the infection is gone, then they are fine.
Okay. Yeah. When I'm sleeping with somebody who snores, I'll pinch their nose and then
wake them up.
Wake them up. Anyway, what are the treatment options for respiratory infections?
Okay. Well, I will only talk about maybe what you can do at home.
Okay.
So the normal, maybe lemon and honey to try and soothe the cough.
Warm water?
Yes, warm water. Usually, yeah, warm water with honey and then lemon should be fine.
Okay.
Yeah, but please don't be doing that for the very small kids.
Okay.
Yeah. But
for kids, what should we do? It gets irritating when the kids are coughing and you don't really know what to do.
When I say small kids, I mean like less than 1 year old.
Okay.
Yes.
Okay.
But once they are older and they can swallow themselves and all those things, the smaller kids, it might be difficult because when they get very weak, you might not be able to notice it very well, and sometimes they force feed the kids and all that. So we want to avoid all those problems.
Okay.
But once the child can talk and then can express, you can do that as well.
Okay.
You can get the lozenges from the pharmacies, vitamin C,
cough mixture.
Cough mixture.
I was told that cough mixture doesn't do anything. Like, why are they selling it? One doctor told me that I'm like, he doesn't really advise we take cough mixture.
Well, people have different opinions about it. Personally, I don't like cough mixtures for children, especially maybe below 10 years. I'm not really. Yeah, but depending on how severe the cough is, it can help to reduce the irritation because the cough is because of the irritation in there. So the cough syrup can soothe what is going on in the throat to prevent the cough, but actually it doesn't solve the problem.
Okay.
So if you are just taking cough mixture, you're not solving the problem. And if it's viral, that means your immune system is what is solving the problem, not the cough syrup.
Okay.
So sometimes people deceive themselves with cough syrup and then they feel the cough is gone down, but then the infection is progressing and it might get worse.
Okay.
Yeah.
Okay. All right. So we'll go with the advice. But at some point, then we'll have to go to the hospital if it persists.
Yes,
we'll
if it persists for more than a week, please visit the hospital and then let them examine you. Let a doctor listen with a stethoscope to the breath sounds in the chest and all. They will look in the throats, see if there's swelling, if the tonsils are inflamed and all those. Because you can't do that yourself at home.
Okay. All right. I've got a couple more questions before we wrap up for today. Now, are there any complications that are associated with respiratory infections?
Yes. If you don't treat them, yes, they will progress. Usually with the bacterial infections, we end up having these pus collections. So like a boil, but it's not out for you to see.
Okay.
So sometimes the pus collects in the sinuses, especially because of those cavities there. Sometimes the bacteria can seed into the eye, like around the eye, so you have a cellulitis around the eye, or even your whole face can get a cellulitis.
Okay.
Sometimes there's pus collection around the eyes, in the face. Sometimes we have what we call Pott's puffy tumor. So you see that the child will have a swelling on the forehead and it's painful. That's like a collection of pus right on the forehead because of the infection.
Okay.
Yeah, so there could be pus in the lungs or beside the lung tissue as well. So if that's the case, that means you have to have the pus physically extracted. Pus, you can't leave it in, otherwise the infection will not go.
Okay.
Yeah.
All right. Because you mentioned when we're talking about cough mixture, kids and adults, are there differences in treatment approaches for children and for adults who have respiratory infections?
A little bit, but to go into that, I don't want to go into that in fear that some people will decide to be their own doctors and then do certain things which might be detrimental to themselves. So see a doctor, and then depending on the type of cough and the examination findings they will make, they can prescribe the right type of cough syrup especially for the children.
Okay.
Yeah, so but with elderly people, they can get even a pneumonia without even coughing at all. So it's best once you have an elderly person and the person looks ill, it's not always malaria. Sometimes it's even a pneumonia, and no one will pick it until they go to the hospital. They do malaria test, is negative. and then they see, oh, but there's infection. When they listen to the chest, then they realize that no,
it's pneumonia.
Yeah.
Wow. Anyways, are there any ways to prevent respiratory infections? Are there any preventive measures we can take?
Normally, just the hand hygiene.
Okay.
And if you do have a respiratory infection, avoid doing things that will spread it out to others. So if you are coughing, make sure you cover your nose and mouth so that you don't spray.
Some people take offense when they cough without covering, and you're trying to prompt them, or you try to draw back from. They take offense. Like
well. Then you also take offense at their offense, because what they are doing is they are trying to give you their disease. Yes,
yeah, but they make you feel guilty. Like, so do I have some disease that I'm giving you or something?
Then you tell them, yes, you do. If you didn't have a disease, you won't be coughing. Normal people don't cough.
Okay.
Yeah, so you don't try to be nice to them. You tell them, you can tell them politely that, oh, Charlie,
you need to cover up.
Your, or wear a nose mask if you know you're coughing too much.
Okay.
Or at least you can use your upper arm, just cover when you're sneezing or coughing. Yeah.
I guess we should be doing more, especially in this season, doing more of the washing hands with soap and you covering with nose mask and, I don't know, using sanitizers. Is it advisable?
Yes,
you can use that
definitely.
as well.
Use sanitizers as much as possible, especially if you are going around offices, opening
doors
and stuff like. You don't know who has touched the doors. There's the side rails on staircases. Those are like the main places people pick those infections from.
I usually try to avoid it, but my ankle and knee doesn't allow me. Now you need to hold for support, but psychologically you think I'm picking some disease or something.
Just have your sanitizer. Once you are done, you clean your hands up and you should be fine.
Anything else to add up as we wrap up?
Yes. So if there's blockage of the nose and you want to inhale steam and those things, please, especially for the children, avoid that. Sometimes the heat is too much.
It's too much for the kids.
It's too much for the kids. Even sometimes for adults too, it's too much, and you end up causing more problems.
The ones that we use with the neem tree and stuff.
Well, I haven't really had any issues about that in the hospital. I haven't looked into it, so I'm not too sure how effective it is.
Okay.
Yeah. But generally,
I think generally that method is really dwelling on the heat.
Yes,
and not necessarily what's in. I don't know. I think part of it is psychological.
maybe. And the pain medications. Please don't give aspirin to children. Children can have very deadly reactions to aspirin.
Do they sell aspirin for kids?
No, they don't sell aspirin for kids.
But some parents will have it in the house and then they'll just give it to the kids because
I had this painkiller at home, and then the child is sick, so then they give the child some of the painkiller.
Wow, they do that.
Yes.
Yeah, I think they do.
So some of these combination drugs, a few of them have aspirin as part of the combination with the drug, and sometimes they will want to give the child some of their pain medicine, and then it can affect the kids.
Let's avoid it. Aspirin, kids. No.
Yes.
The two shouldn't mix
at all.
Anyways, that's it. Respiratory infections. Thank you very much, Doc, for your education this afternoon. It's always sound education for us. I learn a new thing every time you are here. So we're grateful for your presence here on Hello Doc. Don't forget that Hello Doc is on Mondays 2:45 p.m. on the Drive with the Area Gang. Thanks once again for coming.
Thank you.